and some of the strategies and why we need urgent action on AMR. And so this slide shows just what is AMR, first of all, right? It occurs when microorganisms like bacteria, viruses, and fungi develop resistance to the drugs that are designed to treat them. So when they no longer works, and that causes infections, and we no longer can treat it. So MR occurs is a natural phenomena of these microorganisms. But what happens is it speeds up because of the inappropriate and overuse of antimicrobials, which increases the emergence and spread. So in here you can see how an organism develops resistance. So there's a lot of germs and few are drug resistant. So when the bacteria are exposed to antibiotics, it will kill all the bacteria that causes the infection. So it stops the infection and protecting any damage to the body from the infection. However, if it is exposed to low doses, what happens is there will be some of the resistant bacteria that survives, and then once all the sensitive bacteria are killed off, the drug resistance are now they can grow and take over, and this causes antimicrobial resistance, and this go on spread, and this can cause where some of the bacteria that already are resistant, they can give their resistant genes pass on to other bacteria, and the sensitive ones also becomes resistant. So it go on spreading resistance. So this is basically how it occurs. And so this shows. So what is why it is a growing threat, and so the WHO has considered as 10 most threat to the global health. So this is a very serious issue. So it has emerged as one of the most leading public health threat for the 21st century. So basically, it almost threatens the effectiveness of modern medicine, surgical procedures, and cancer treatments and organ transplant. Basically, this leads to infections that were once treatable becoming more difficult to manage, leading to longer hospital stays, higher healthcare costs, and increased mortality. So this shows that worldwide that deaths that can be attributed to AMR every year compared to major other causes of death. So by 2015, it has been estimated it will go up to 10 million deaths. So this is quite concerning. And this is a very nice paper that talks about overall how AMR pathogens, the cause and mortality worldwide. So it's 1.2 million deaths worldwide occurred in 2019, so which is attributed to AMR. So this is a significant issue, global public health issue. So that's why we need to. So like going back on some of the historical beginning of development of antibiotics. So in 1928, first penicillin was discovered, but however it took some time for that to be developed as a tablet and be used as in treatment. So in 1940, while it was just as developed, resistance occurred. So 1943, so even before the introduction, so there were some penicillin resistance, Staphylococcus aureus. So what this shows is with each introduction of a new antibiotic is followed by some resistant homonism. So which each one there is resistant. So the reason is now that it is because of misuse of antibiotics, this is being accelerated. So even by the time the drug is being developed, it already has some resistance. So this is why it's a very difficult issue, because we are competing against developing the drugs while at the same time trying to find antibiotics that actually are sensitive. So for this reason, because it's resistant is developing so fast, and the drug is becoming kind of useless. Pharmaceutical companies are not actually interested in, developing drugs. So this is also, and also the rate at which it is developing resistant is so fast that it is we don't have enough time to catch up.
Yeah, do you want questions of comprehension in between?
Yeah, go ahead.
It looks like since 2010 there have not been any more resistance occurrences, but I don't think that this is correct.
2010.
It's
So
the
maybe
last on your slide.
this is what we're talking about based on that drug. So it doesn't mean there is no resistance. It means based. So this is talking about based on that drug, the resistance occurred.
I understand, but there's no further resistance mentioned after 2010 in your graph, at least.
So,
Ceftaroline resistant staphylococcus is the latest one, 2011.
yeah.
So ever since there hasn't been any more.
No, maybe it's not represented here, but I don't think that will be like, if it's a continuous process, it will have resistance. So maybe, so this, I took it from a paper, so maybe it's just not mentioned here, or it might not be significant enough to be in this graph, so like maybe that might be the reason. But this graph basically just shows, I put it there just to show that with each introduction of an antibiotic, it follows resistance keep following. So that's that's the rule. Yeah. So this is, I just wanted to highlight how AMR is developed, how the bacteria is able to outsmart the antibiotics we develop. Basically, when you have an antibiotic, it is very specific. It targets a specific part of the bacteria. So bacteria get smart once they are exposed. They know the drug and they develop ways to overcome it. So, for example, one way is developing an efflux pump. That means because most of the drugs, they will need to enter the bacteria in order to kill it. So if they're not entering, the bacteria is going to be resistant, right? So they develop this smart mechanism where they kind of pump out the antibiotic out of the bacteria, but this is a normal feature of the bacteria because there are things for them to survive, they have to exit. So, but then they figured it out, like, okay, this is a toxic, we need to get rid of it. So they have figured out, so the efflux pump is one mechanism by which they become resistant. And here, number 2, so they also modify targets. So because it's like a receptor, you're going to bind the target, but if they modify it, it no longer works, so it becomes useless. So that's one way. And then the other way is like they started degrading the antibiotic, so it no longer works. And so they have these enzymes that breaks down. So one that is really famous is the beta-lactamase, which causes resistance to penicillin. So it no longer works and it degrades. So so it also modifies the enzymes. And so this results in, bacteria, they have plasmids, and in these plasmids, they carry AMR genes, which can also be transmitted to other bacteria. So that's one way of them transmitting, kind of giving that resistant genes to other bacteria. So this is overall how bacteria develop this resistance. So this is more focused on bacteria, but other organisms also have similar kind of mechanisms to overcome the antibiotic. So this helps you understand how, like in the environment, if the antibiotics are present and the bacteria is present, they are exposed to this, they become resistant in the environment. Once they are exposed, not inside the body, but in the environment, and if you get an infection from the environment, then, because already they have been exposed, they know the drug, and they become resistant inside the body. So this shows that how overall, AMR spreads through humans. So it's not only humans, this makes it more complicated. So humans, animals, and the environment, how everything is linked. So when we have the antibiotics, so someone John gets an infection and he develops a resistant bacteria in his gut. He might not know about it. He might be just a carrier. He goes into the hospital. He might get care in the hospital. And a person who is more vulnerable might get that infection. And this could, lead to being that infection going on and spreading in the hospital. So resistant bacteria spreads to other patients from the surface or within the facility. So that's why hand washing and all this is important. So patients then go home, they go into the community, and or they can also spread in the community, and also it spreads inside the and healthcare facility where resistant germs spread directly to other patients or indirectly from unclean hands and healthcare workers and go into the community. So this is where in the healthcare settings. So this could be, and also in healthcare settings, bacteria are more exposed to antibiotics as well, and so they keep, the exposure makes them more resistant, and then it goes on further spreading. And then the other route where they spread is through the animals, because we give animals 70% of all the antibiotics are actually used in animal. So they are being exposed to animals, and sorry, the antibiotics are being exposed, and then animals get antibiotics and they develop resistant bacteria in their guts, and then it goes in the excretion waste. It goes into the farming, or it could get contaminated the food crops, and then again it goes into the community, and someone again maybe George, that might be how George got the resistant bug in his gut, so it keeps on spreading. The other area is we also have drug resistant bacteria that remain on the meat and from the animals, and when it is not handled or cooked properly, the bacteria can spread to humans. So this is how the overall is from humans, animals, and the environment, how it is interrelated and how it can spread. So basically this graph shows so I mentioned before, the study by Lancet in 2019, they 80,000 is, or because this shows different bacteria and its contribution to attributable contribution by number of deaths for each bacteria. So there's a portion that is due to antimicrobial resistance, and therefore also there is a portion of bacteria that are associated with sensitive ones as well. So you can associate, so when you get an infection that is drug resistant, what you are less likely to, you're more likely to stay in the hospital for longer because it takes more treatment. And so basically, you're more likely to die of that infection. So this shows that the global impact of AMR and based on different bacteria. What I want to highlight here is when it comes to AMR, there is the burden of AMR is higher in low and middle income countries. The reason for this is because they have inadequate access to healthcare. So they have lack of proper diagnostics, and it leads to inappropriate use of antibiotics, because if it is not diagnosed, they go on, and even when they don't need the antibiotics, they take the antibiotics. So that could also be one of the reasons. And there's poor infection control. so limited resources, and this is a big thing in terms of poor countries. There's resources for sanitation and hygiene, so that's one way the bacteria spread. And then again, which is more common in Southeast Asia countries, where many they're able to buy antibiotics without prescription, so therefore increasing the misuse. So in India, example, 60% of antibiotic sales occur without a prescription. So that's a big issue. Um, so this is some of the compared by regions of WHO. So so you can see here sub-Saharan Africa, they have the highest burden associated with AMR deaths per 100,000 population. So the reason again for is limited infrastructure and high rates of infectious disease there. And South Asia, they have a high prevalence because largely driven by misuse of antibiotics. And in high income countries, although the prevalence is lower, the burden on the healthcare system is significant because it increases the hospital stays and increases the treatment costs, and they're basically able to afford these treatments, and so it increases the cost of healthcare in these regions. So the main causes of antibiotic resistance is because of overprescription of antibiotics, inappropriate use. So you saw previously how bacteria develop resistance because they have been exposed, they're exposed to antibiotics. So if it is, when you have a viral infection and you use antibiotics when you don't really need it, so what might happen is your commensal or gut bacteria might develop some of the resistance. They can transmit to other, so it goes on. So this is also a big issue. People do stop taking the antibiotics early, so this means that it kills off all the sensitive ones, and there remains a lot of bacteria that are more resistant. So they're getting a chance to develop resistance as they're exposed to smaller concentration of antibiotic, which doesn't kill them, but they learn how to overcome that. So which makes it worse as well, which is very common. People do like they feel like they're better, so they don't need to take on antibiotics. And then again, this issue in terms of overuse in agriculture, antibiotic use, livestock and fish farming, that also spread. You saw how it is spread, and so this is a big issue in terms of sometimes antibiotics is used because they have poor hygiene. So to overcome that, they just give antibiotics so to perfect the before they need it, they don't even have an infection. So just in case that because of the cleanness, but if you keep clean, and there's less likely the animals to get infections, and so it reduces the use of antibiotic. And also still it's being used to promote growth promotion in small quantities. And we have so for infection control. This is in most of the cases where like low and middle income countries where they still have infection in the hospital. Some of the hospitals they don't even have a way of washing their hands. So this create more chances where doctor goes from one person to the other, and there might be one patient is contaminated and infected, and then it goes on to and poor hygiene and sanitation, and lack of new antibiotics. So that is a big issue because nowadays pharmaceutical companies they're not going after antibiotics because they're very cheap and it still costs to develop it, and so and also they're more focused because infectious disease. At one point, they were saying, okay, there won't be an issue of infectious disease. We need to focus on NCDs. There was a time where there were a lot of limited new developments in terms of new drugs. Although now because of MR, the government is trying to, it's like encourage the pharmaceutical company like on a subscription basis. Like Netflix, you don't really need it, but you are subscribing, you are giving the money in terms of when you need it, you will have an antibiotic. So that's kind of trying to get them to develop new drugs. So these are critical factors when it comes to curbing the antibiotic resistance globally. So what I will do now is now that you already know like how serious this issue is, the consequences are far-reaching, and it's almost we might, you know, um, there might be a time where we might go into post pre-antibiotic era when we didn't have any antibiotics, so like surgeries and cancer treatments and organ transplant depend on effective antibiotics. So the doctors might not even want to go ahead with the surgery because the risk of getting an infection, multi-drug resistant infection, can be so severe that you're going to die because of that. So without any effective antibiotics, the mortality rates for routine medical procedure will go up significantly. And then there's this increased mortality, morbidity and mortality. So common infections like urinary infections, pneumonia, are really becoming harder to treat. For example, drug-resistant E. coli, which causes, so it's being reported in many countries. And then the economic consequences of AMR is since you have increased healthcare costs, longer staying, so it's becoming more expensive. And this also is a global health security issue because AMR doesn't respect the borders. So if you have an AMR, the organism, without even knowing. So the case in the Maldives, is like a lot of people, they go abroad for surgery and treatment, and most commonly in India. So they might they might be infected with a multi-drug resistant organism, and then when they come back, and if they get admitted into the hospital and we don't check but however in the high income countries like UK, they do check whether you have any kind of infection. So it's so these are being imported, and um, people are more likely to travel nowadays, and so that's also increases outbreaks of resistant infections, and it complicates again infectious disease because now you have infections that are no longer works with your normal antibiotics. So you have to so it can go on spreading and causes. So again, so this is a report, and they estimated the economic burden of 100 trillion by 2050 because of the increased cost. So this is a good report by O'Neill. He talked about, he's an economist. He was asked to do this report by the UK government. What sort of impact it will have on, so it's not only in terms of economic impact. So I think when you put a figure to it, people are more kind of worried, and how much it's cost as well. And when it comes to treatment cost for drug resistant versus a sensitive one, it is almost 10 times higher. So that's another issue. And then when it comes to agriculture and food security issue as well. So you already know that it can spread through the food chain as well. And again, this is a big factor. Farming contributes significantly to AMR, and it increases. So not we so the way it becomes a threat to the food security is because of course, animals do get sick as well, so we need some antibiotics for the animals, and they are also getting antimicrobial resistant drugs. We cannot, so it will decrease the um, animal population. So what I will now do is do go back and I'll share a presentation which focuses on the Maldives. So talk a little bit about. So, oh, I need to share this. Oh, is it already shared?
It's already shared
Yeah,
because
okay.
you share your full screen.
Okay. Okay, so what I just, in terms of those who don't know about the Maldives, in terms of the reason I put the Maldives, is because when it,
Make it in presentation mode.
yeah. Okay, so the reason I put the country background in Maldives is like when it comes to Maldives, it gets more complicated because of our geography. So for those who don't know about the Maldives, I have the map there. So Maldives basically comprises of 1,200 small islands, which is spread across 90,000 kilometers of ocean. Which creates logistical challenges. We have a small population and limited arable land for agriculture. So compared to other countries, when it comes to AMR, it's more focused on import of AMR because we don't have manufacturing or chemical industries which also contribute to AMR or agriculture at a larger scale. So which prevents us, so which means that we will not be using any antibiotics in the farming sector, and it will not go into the environment. So it will be only mostly when it comes to MR, it will be those that gets important. And the other thing I wanted to highlight is because we depend heavy imports, so we almost import 90% of our food, including frozen chicken and livestock, and so there's limited livestock farming, and even when we have, it's mostly small scale. It's not a formal veterinary services there. So in this context, it becomes again an issue when it comes to AMR. So this is basically just showing an island versus a resource. So we have in terms of inhabited islands, we have 200 inhabited islands, and we have touristic islands, which again I wanted to highlight is that when it comes to tourist island, it is not integrated into the national healthcare system. So even if they get sick, it's not going to be reported or anything. So we don't know unless tourists come to Male and see a physician there, but in the island, in the tourist island, they already have a physician there in the island, based in the island. So it's very much outside kind of the country. It's not integrated into the national, so we cannot really capture anything that happens in these islands. And when it comes to the small rural islands, they depend on fishing on small scale, and nowadays tourism, local tourism, and again, they have limited access to healthcare, logistic constraints, and climate change vulnerability. So that means they could, when it comes to MR in terms of because of like since they might get antibiotics through a friend, or we don't know how, it's much easier to get antibiotics because they cannot really easily go to see a doctor in the capital city, and sometimes they don't get proper diagnosis because they don't have lab facilities where they can diagnose. So nearly most of the case, like even if you have a viral infection, you might get antibiotics. So this creates again another challenge. So because of the dispersed nature, it increases the MRs and also when it comes to even though there are small scale farming, we don't know what kind of practice, whether they do give antibiotics or not. But I'll show you. So this is the capital, which shows a very different scenario. It's very congested. This is where I live as well. So this actually the urban side also create a very kind of right condition for AMR because when it's a small and you get the infection transmit easily and yeah those kind of things and so again when it comes to imported food, so as I said before, the AMR is mostly being imported, but since it's not being tested or not, no surveillance is there, we don't really know the community AMR. Um, so, this is just to show that I have been involved in AMR research in healthcare facilities, but this is not prospective studies. This is based on data that was collected because whenever patient comes in and they suspect an infection, some of the time they do, the doctors do AST, which is antimicrobial susceptibility test, because the doctors, before they can actually give the antibiotic, they need to know which one is sensitive. So if you give penicillin and it's not going to work, the patient is not going to get better. But so the doctors need to know, they test a panel of antibiotics against the patient's isolates, and then they find out which one is sensitive, which antibiotic works, and then they give the antibiotics. So because of that, the hospital database, they have specimens of this data. So we collected this data and look at the AMR profile of these bacteria, and we are finding it very high resistance. So this shows the resistance. So this graph shows the percentage resistance, and this is the series of antibiotics that get tested for each organism. So when it comes to these are gram-positive bacteria, this causes blood infections, various infections, so upper respiratory infections. So which is shown that these are becoming more and more resistant. So the less and less sensitive. So this shows that AMR is an issue, and
I'm sorry, we just have a minor technical issue here. If there's already a quick question in between, then you're welcome to shoot. Any questions? Yeah, there's like a number of people.
There are 6 people.
No, it's over 20.
But
Yeah.
whoa, perfect audience. Questions to you.
yeah.
Hamima, yeah, go ahead.
Every generation.
Hi,
May
Hamima.
I ask?
Yes, yeah.
Okay. Yeah. So great talk. Thank you very much, Dr. Camille, for the interesting talk. And yeah, in Maldives is very beautiful. Okay. I would just like to share a recent work from my colleague in Monash University, where she worked with the indigenous communities in Malaysia, not the one in Segamat, Sandra. This is somewhere else, more remote, and they don't have access to healthcare and farm poultry. So they are like hunter-gatherers. But in this study, she found that even in these marginalized, remote indigenous community, they have developed resistant to specifically to this colistin resistant. So this is alarming because this is the last resort, antibiotic for in terms of treatment. Can you comment if you have like the state of the art of literature, or even if you found any like in the rural communities in Maldives or anywhere, this kind of case where they don't really, get antibiotics from the healthcare, or even poultry from the supermarket. They are hunter-gatherers or fishermen. So can you maybe comment on this?
Okay, when it comes to all this, I think the issue is like lack of data. So I wouldn't really be able to say anything because we don't know like what is really, because especially when it comes to rural population, we don't test, or we don't know like, so only the data we have is through when people get sick, they come to the hospital, and that's where when we catch the most drug resistant isolates. So actually, when I showed the data, that is only the data that is being captured, which is the capital. So we don't know, but there could be. I mean, that's a very interesting study as well. So this is something that we also can look for, because like how did they acquire that resistant organism, and how, so that means, because it's been said like bacteria, they're very promiscuous, where they, give out their resistant genes to other organisms, and if they are in the environment and someone gets exposed, they don't have to be in a direct contact. Somehow they got this infection. So it is happening more frequently, because I think as resistance is increasing and these spots are developing this resistance, and even though they're not directly, being exposed, they still get this. So it's very interesting case. Colistin is the last resource antibiotic, and also one thing is this could be like a, when it develops resistance, the gene could be multi-drug resistant. So that means they not only develop resistance to one organism, they develop resistance to many drugs. So that could be also one reason. And the multi-drug resistant organisms, and then they pass on these antimicrobial resistant genes, and that could be one reason. But I think to answer your question, in short, we don't really know, because no one is really testing. So it's only been recently, 2017, we started looking at it. But I was just going to show you the next stage, where like the data we have is from actually very sick patients, or people who are actually coming, seeing the doctor. That's how it is being kind of flagged. Yeah, I hope that answers your question, and you're able to relate to.
Yes, yes. Thank you.
Okay, thank you.
Is the battery back or? Not yet.
Do you want me to send it to you?
I think maybe there's another question, and I
Okay.
think it will charge.
Yes,
Very.
yeah. Yes.
I know it's good for. Okay. I just looked at ChatGPT. What's the link between climate change and antimicrobial resistance? Both key pillars of global health. And there are six points. Climate change alters the ecosystem. Our human microbiome, even the oral microbiome in our cavity, let alone the one in our gut, changes with temperature and with other items of climate change. So does the microbiome of animals. So does the microbiome of plants. so does the microbiome of the soil. So there's a huge agenda now for bacteria to exchange different changing microbiomes, to exchange these information through plasmids and through other things. The second is they survive longer because of heat and reproduce faster outside. Yeah. And then there are many more. So I invite you to use ChatGPT and see six. And they say that fighting climate change is one of the pillars of fighting antimicrobial resistance. Isn't that amazing?
Yes, I agree.
First time I learned.
Yeah, I mean, there's,
The wonders.
there's a very much interest and explore this area.
Is it? I mean, you cannot trust what ChatGPT is saying, just like that.
Yeah.
I mean, it might be one of the dimensions, but
It sounds well.
I mean, to me, it seems like the mass rearing of animals was one of the leading factors contributing to antimicrobial resistance, especially in the way we're doing it in the West, where the animals are so close to one another that you have to give antibiotic as prevention.
Yes.
Preventively, and all this antibiotic end up in the environment where it can spread. It's a very natural process. So maybe acting upon that, maybe, I mean, okay, climate change is a whole different issue you're reaching.
Yeah.
So, I don't know, to me, the factors of, treating the mass rearing of animals where they're packed together and they cannot survive without antibiotics, that was one of the main motor of antimicrobial resistance. So maybe not in the manuals where you have that, where you
so in the case of molars, it makes it simpler for to study what is happening in the clinical, how it's important. So it kind of eliminates the agricultural component of it. But whereas if we study it here, we have to look at the environmental factors as well. But in the molars, we can do like that helps us to simplify the way we study. But anyway, so then we can also look what you said, the contribution. So in the molars, it's without the animals, so it's still happening. So that means how much it's contributing versus we can compare with here, for example. So as you say, like one large factor is agriculture. So in the molars, we like eliminate that and see what is happening as well. So we can compare how it's how much agriculture is contributing versus if there is no agriculture is still. So we can kind of look at into that. But anyway, what you said is I have come across papers because Europe, they started they banned antibiotics use in farming, and now they're actually seeing the results. There is some decrease, especially in the case of Netherlands. They are seeing some progress because they have the policy where you're not allowed to use antibiotics as growth promoters, and it has actually shown it works. So yes, that kind of answers the question. Like, okay, it is if we do try to stop at least one factor, it will decrease. So yeah, but I don't know exactly how much it contributes. So like you said, like it is a large contributor. You're right, because 70% of antibiotics is actually given to animals, not humans. So that can be a large factor, yes. So in terms of the climate change, I have come across papers that they have started now focusing and doing research in this area. So climate change is very much in terms of, it's not very well known because these are because before we go into something, climate related, we have the obvious ways we can reduce AMR. So it's definitely focus on those before we try to, but it will be also interesting to know because the countries where that has the worst case of AMR, like Southeast Asia, they're also facing climate crisis. So like the Maldives, other sub-Saharan Africa. So this could be making the health, which is worse, already worse as well. So that's also like worth understanding and trying to find out how it contributes to AMRs. So, so in terms of what I wanted to show is like I have started doing research in the area of AMR. So first I started with finding this easy data sets, which is not the best because it's not for, they're collecting this data, not for research. So it's not what you want to, but it gives like a snapshot of AMR in the Maldives based on clinical isolates from these patients. And also if we can the next thing to go on, it will be interesting is like in the West, they have done a lot of studies where, a person gets a sensitive bug versus AMR bug and how, their hospital stay is longer, but it has not, and the likelihood of dying is higher, complications is higher, but in the Maldives, we don't know that because no one has actually looked at it, where people who get this AMR infections, how do they actually, how much worse off they are in terms of if they do get a sensitive and how much actually is it costing. So in the UK, they have actually done the costing, but in the Maldives, we haven't. So when it comes to a lot of the time, it's about the money. So if we show them like, okay, this is costing the healthcare a lot, and at the same time, people are dying, highly likely to die because of the mortality is increasing. So this is something we need to look into. So that's one area. Like in Maldives, like it's just of the iceberg. We know that it is really getting bad, and also they have started. So WHO have started surveillance. So it's only based on hospital these isolates as well, but it still gives the trend. So I was about to show you this graph where over the 5 years they have looked at all the isolates and all the tests done, and then it increases. They have tested for the last resort antibiotics, so that means we have used up all the first line treatment, and it no longer works. So then we have to go to the carbapenems, which is the last resort antibiotics. We really shouldn't be using it, but because the others they don't work, so we have to use it. So actually, we need to save them, unless if you have a sensitive, you won't use that antibiotic. But when it comes to resistant, but people are developing, not people, the bacteria are developing resistant to the last resort antibiotic as well. So in India, even in Maldives now, like there's been reported case of colistin resistance. So that means the doctors, they don't have anything to treat you with. So they're very highly likely you're going to die of an infection. So going back to the post antibiotic era, the pre-antibiotic, so it just could be, yeah. So I think, and then I was going to focus, which is the part I've started doing research where I'm looking at the livestock, not the livestock in the sense food security, because we import all our food, and then I'm looking at chicken. So chicken is most of the time that we get contaminated with salmonella. So when someone eats not a properly cooked chicken, or they get an infection, and if it is like sensitive, they're going to be okay in a couple of weeks or at most. But what happens is if you get an antimicrobial resistant bug, and then you're going to, and if you are like children or vulnerable, you're more likely to. So I'm looking at the prevalence of salmonella in frozen chicken, and then I'm testing these to see, the level of antimicrobial resistance in these isolates. So this is where basically what has been done, the farming practices that has been used in Brazil, because Brazil is, we get about 90% of all the chicken from Brazil. So it's being imported into the country, and this is the kind of the issue. So what happens is when it comes to how it gets complicated is most of the time, the mold is like, because of lack of regulation resources, we don't check our, we don't even impose any condition on the exporting countries. Whereas Brazil, if they're exporting to the EU, they have to follow the EU standard. They shouldn't be using, maybe, I don't know how much it is, maybe like, so if they are importing, exporting to the EU, the standard might be different to whereas if it is being imported to the Maldives. We have, we don't have much regulation in terms of any requirements, because I know for a fact when we export tuna to UK or European Union, they ask to test. It's mandatory to test for histamine. That means it gives the quality. Histamine is gives allergic reaction, and a lot of people are not very tolerant to. Maybe we have developed tolerance over the years, being exposed to histamine. But our tuna is not tested. So when we are trying to export, it gets tested. So there is this, differences in regulation, and so quality of the food. So this could be something, in terms of if Brazil has a different kind of, how it's being, because if we don't have any requirements, they're not going to be following us. So that could be another area. And so in terms of farming, and also the public awareness is another issue. So in the Maldives, people, still demand antibiotics when they get the flu, and they feel like, if you don't get the antibiotics or any treatment, it's like, the doctor is not good person, so those kind of things. So it's MR is, there's the social side as well as the clinical side, social factors. So so like you are able to buy antibiotics if you go to a pharmacy. So the professor I'm working with, he came to the Maldives, and he does this test where he goes to all the these countries where you can buy antibiotics just to check whether you can buy it. And then he said, he was able to get a big bag of antibiotics. He just simply told that he was having diarrhea, and actually the pharmacist shouldn't be giving any antibiotics, but they did. So this could be, because he's a foreigner, like even if I go and ask, they might not give because they might be worried.
There's one more question.
Yeah.
I see a question of Sianga Mutola.
Yes, please. Thank you. Thank you very much. Yes, I'm Mutola. I'm from Zambia. I'm actually a doctoral student, supervised by Dr. Valerie there, and I'm glad to see her. Thank you so much for the wonderful presentation. And I want to confirm that I think antimicrobial resistance is really a big issue, especially in low-resource countries like Zambia, where I am. And I couldn't agree more with you on the point of unregulated over-the-counter prescription of antibiotics, which is very common in Zambia, and I've picked battles several times with pharmacists here. But my question is around the use of complementary medical products, traditional products, especially in Africa, and I think some parts of Asia. I know that many of our populations here would seek traditional remedies and take traditional concoctions before they actually seek conventional treatment. Has there been any effort to try and investigate that and its contribution to the resistance that is being seen now? I know that even when you go to China, there are several products that are sold on the black market. There are teas there that are believed to have antimicrobial effects. Has there been any investigation to see to what extent some of these complementary medical products would be contributing to what we are seeing now in the field of antimicrobial resistance? This is just some thought to also extend from what we've seen already. Could there be maybe a contribution from this? Thank you so much. That was the question.
Thank you. That's a very interesting point. Yes, it will be very interesting to know, like, because a lot of these countries, they do have like traditional, so they do go and Chinese medicine, but although in the Maldives, that's not practiced as much. But it will be really interesting because what's interesting is like nowadays WHO is trying to actually ask people to, because it has been proved like traditional medicine in the sense like for cold, and it is promoted as an alternative sort of medicine. So if so if it is not being tested, so like I've never come across any studies where they have actually done studies where like the effect of traditional medicines in terms of how it contributes to AMR. So, but it will be interesting to find out, because since kind of WHO is more promoting nowadays in terms of to people to seek traditional medicine as well as an alternative to antibiotics. So like at home cold remedies, like, you know, having lemon or garlic or this kind of natural kind of remedies. They're also trying to, you know, encourage people to go for those kind of treatments rather than, you know, going for antibiotics or even try to wait until the cold. People sometimes they don't want to, like, it takes like 7 days for you to get better, but before like 2-3 days they might go to the doctor and get antibiotics. But you know, and so in this case you can go for alternatives at home remedies, honey and this kind of things. It does help. So, but it will be very interesting to find out, because in some of the countries, India, like in your case, they do, this is a large part where they use traditional medicines, and how does it actually contribute? Because this could be like, even though they are plant-based or natural-based, they could also contribute, you know, those chemicals where that, the bacteria, if they're exposed, and they can develop a way of resistant. So what happens is, if they are being exposed to even like general household disinfectants, they're being exposed, they do develop resistance to antibiotics. So that could be an interesting area to look into. And so, because I know for a fact that when you use disinfectants, it also causes bacteria to become resistant to antibiotics as well. Does that hopefully that answers your question?
Yes, he gave a thumbs up. All right. Are there any further questions? Last opportunity. All right. Otherwise, yeah. Thank you so much, Sonia. And thanks, Hamima, as well for co-organizing, and thank you everyone for attending. Then have a good